65 million people around the world today are displaced by violence, famine and poverty. A third are refugees who have fled abroad, according to the United Nations Refugee Agency. But officials say the funds needed to help them have been wholly insufficient.
We usually globally operate with about 50% of funding, which means we can't do as much as we need to do in order to keep people safe and meet their most basic needs.
The UN's humanitarian system isn't just broke, it's also broken, writes Professor Paul Spiegel, a former official at the UN Refugee Agency, in a report published in The Lancet.
The humanitarian architecture was created for a different time, so it does need to be changed. As I mentioned before, even though more money is coming in, it's not sufficient compared to the needs. The needs are still outpacing.
Today's refugee population stands at 22.5 million and counting, due to new emergencies and ongoing conflicts. For perspective, I'm here in New York City, population around 8 million. We would have to triple that to surpass the current refugee population. So imagine having to generate enough funds to feed, clothe and house a population nearly 3 times the size of New York City, spread across multiple crises and conflicts. Spiegel is recommending that aid agencies consider reforms tailored to the needs of each refugee and host community, including providing cash cards for refugees to spend locally or helping fund a host nation's healthcare system. The UN Refugee Agency says such programs are already underway, thanks to an ambitious new UN refugee response plan adopted in September that combines humanitarian aid with development assistance.
In other words, let's bring in the development funds that usually go to host countries to help their service providers, but also expand inclusion for refugees and top that development funding up so that we have a more robust response that helps both communities over the longer term.
Kelly described how in Lebanon, joining forces between humanitarian and development funding allowed the country to improve the schooling system while expanding it to accommodate refugee children, an approach that can also be applied to improving healthcare systems. Liling, CGTN, New York.